Okay, we're going to finish the physical examination. I need you to lay down on your back for me, please. We're going to inspect the abdomen. I'm going to look. It's flat, symmetrical. I'm watching to see if I can see an aortic pulse, which might indicate an aortic aneurysm. And I cannot see it. All I can see is his rising and falling with his respirations. Next, I'm going to auscultate all four quadrants. Bowel sounds are active in all four quadrants. Next, I'm going to percuss. I'm going to percuss up and across and then back down. It should sound somewhat like it's hollow, filled with air. If it sounds like it's solid, filled with fluid, then that could indicate a problem. From there, I'm going to palpate. First, I'm going to start with the lower right-hand quadrant. I'm going to do light palpation. Any pain?
No.
I'm working my way across. I'm palpating the bowel right now.
None.
Okay. And we're going to go up just underneath the ribs. I'm going to feel the liver. You take a deep breath. Any pain? Okay. I'm going to go a little deeper, see if I can find the gallbladder. I think it's right there. So there's no pains, no lumps, no nodules. I'm going to go to the other side. Palpate the spleen. No issues. Okay, now I'm going to palpate the femoral pulses. I'm going to find the iliac crest. Nice and even, nice equal bounding. Iliac crest. There it is. Alright, I'm going to have you sit up now with your feet dangling. We're going to start with the fingers, the wrist, and the hands. Just kind of look at them real quick. First off, we're going to start. I'm going to just inspect. He doesn't seem to have any deformed fingers, no arthritic joints, no swollen, no redness. Are they sore anywhere? Can you do full range of motion? Can you hold them together, open your fingers up? Okay. Now can you flex and extend? Can you abduct and abduct? Alright, thank you. Alright, now I'm going to check and I'm going to palpate what's called the snuff box. I need you to hold your hand like this with your thumb up in the air. Right there. If there's any pain, whenever I palpate this, it could indicate a problem. No pain. Can't do the other side. Thumb up. Nothing? Okay. Now I need you to put your hands together. Push them together for 30 seconds. Okay. Any pain? Now I need you to hold your hands out like this. I'm going to apply some pressure right here in the notch. Does that hurt at all? If this hurt, it might be a sign of carpal tunnel syndrome. It doesn't hurt. Now we're going to do the Allen's test. I need you to hold your hand out again. I'm going to include both the ulnar and radial arteries. Close your hand, make a fist, open it up, uninclude one, and the hand turns pink. Okay, I'm going to do it again. Close your hand, open it up, hands white, include the other, and it turns pink. Okay, and they would do that a lot of times before they're going to start an arc line. From there, we're going to go to the elbows. I'm just going to feel up and see if we've got any soreness, anything hurt there. There's no nodules or anything. Okay. Now I want you to open them up, in, back out. Can you? Alright, pronation, supination. Alright, now we're going to go to the shoulder. The shoulder, I'm going to first look at the suprasternal notch. I'm going to find it. I'm going to walk my fingers across the collarbone, the clavicle, to the chromium process. Is there any pain? Nothing? Alright, now we're going to check for his range of motion. What I'm going to want you to do is hold your arms straight out, back down your side, straight out in front of you, back behind you. Okay, now I want you to take your right arm and cross it. Is there any pain or any issues? And then back behind you, try to touch your other scapula, and do the same thing with your left arm. Okay, now I want you to hold your arms down here at your sides. I want you to move it in, back out, in, back out. Okay, now I want you to hold your arms straight out with your hands cupped upwards. I'm going to push down and I want you to hold resistance. Okay, and it turns to where it was. Now, you can drop that one. I want you to hold your arm straight out again. I'm going to put my hand on the patient's scapula. I want you to raise your arm, back down. Okay, no issues there. Now we're going to do what's called the Hawking's test, where we're going to have you do essentially the same thing you did, except for this time, I want you to raise your arm, bend your elbow, and then I want you to rotate it in. Any pain? Okay. Alright, now I want you to take that same arm, do both of them at the same time this time. Raise them up and bring them slowly down to your side. Okay, no pain? Alright, if there was any pain or anything, or he wasn't able to hold them without dropping, that would be maybe indicative of a rotator cuff injury. Okay, now we're going to go to the neck. The neck, I'm going to inspect it. There are no lesions, no bruising, no bumps, no swelling. The trachea is midline. I'm going to palpate. I don't feel any lumps. Okay, now we're going to do range of motion. Why don't you do the circle? Any pain?
No.
Do it one more time. I'm feeling to see if there's any crepitus, any cracking or anything like that. Okay. Alright, now I need you to put here on your shoulder, here on the other shoulder. Okay. Now I'm going to have you stand up. You face that way. Now I'm looking for the convex and just the regular curvature of his spine right now. And I'm looking to make sure it's convex here and concave here. And it looks like he has no issues. I'm going to stand behind him. See, his spine looks to be straight. I'm going to start up here at C7. I'm going to palpate my way down, checking to see if there's any bumps or protrusions or any dents or dimples. That might indicate that he's got a vertebrae that's twisted slightly. Okay. Now I need you to stand, face that way. I need you to bend and touch your toes. Okay, while he's bending, I'm going to feel his spine again. It's nice and even. No issues touching his toes. Okay, now I need you to do extension. Alright. Now, if you'll lay back down for me. Just go ahead and lay down. It's fine. Alright, we're going to do what's called the straight leg test. This test is for any sciatic nerve problems or issues. I need you to, with your knees straight, I need you to lift one leg, set it back down, now the other leg. Okay. Excuse me. Now, I'm going to check for range of motion and just some in general against resistance. I'm going to bend your knee, press against my hand. Okay. Now push down. Okay. The other one. Push down. Alright. Then we're going to do some range of motion. Don't want you to pull this leg towards this one. This pulled over. Okay, now back down. Now sweep it out to the side. Okay, and do the same with the other leg. Out to the side. Alright. Now, you can go ahead and sit back up. We're going to inspect the knees. You can just sit up. Sit there on the edge with your feet anyway. Alright, first I'm going to inspect both the knees. Look for any swelling, any redness, any irritations. His skin looks pink and warm. There's no lesions anywhere. He's got an old injury over here that he got about 3 weeks ago with a slight bruising, but that's not an issue right now. I'm going to palpate the knee structure. I'm going to check for the femoral condyles and the tibia and fibula condyles, and then I'm going to look for the medial,
Meniscus.
yeah, the meniscus space. Is it sore whenever I touch it there or anything? No? Okay. Now, I'm going to move the knee. Any soreness or anything when I do that? Okay. Can you push your toes down, pull them up on circles? Do the same with this one. Okay. And I would inspect his knee also, but I'm not going to do it right now because of time constraints. Alright. Now, I guess I'll go ahead and do the ankle one down here so I don't have to have him sit again. I'm going to inspect the ankle, inner and outer malleuses. There's no really protrusions or bumps that sore at all. No soreness there.
Nope.
Okay. I'm going to palpate the metatarsals. No soreness.
Nope.
Nothing with your toes.
Nope.
Nothing with the soles of your feet. Your arch doesn't hurt. Okay. Alright. Now we're going to move on to the cranial nerves. The first one is the olfactory nerve, which I can't really do that because that's smell, so we're just going to skip it. The second one we've already done, which is the optic disc and the optic nerve. I did that whenever I looked into his eyes. They were both normal. The third, fourth, and sixth, which is the oculomotor, trochleomotor, and the abducens, is the 6 cardinal views or views of gaze, however you want to say it. And we've already done that, and he followed my commands good. That was on the beginning of the video. And then from there is the trigeminal. So we're going to test that by clamping his jaws. Okay, now move your jaw side to side. Next to the facial, I need you to smile, frown, puff your cheeks. Okay, pass that real good. The next one is the acoustic, is a whisper test. I'm going to whisper in his ear, and he's going to repeat the word.
Apple.
Okay, he said it right.
Baseball.
Okay, the next one is the glossopharyngeal, and it is the swallow and gag. Well, not so much the gag, but swallow and ah. So I need you to swallow for me. Can you open your mouth and say ah?
Ah.
Alright, the next one is accessory, and I'm going to apply pressure, downward pressure on your shoulders. I need you to shrug. Okay, no issues there. And the last one is hypoglossal. This one, I need you to stick your tongue out. Tongue is midline. If it was shifting one way or the other, it might show a neurological deficit or like possibly a stroke on one side of the brain, depending on which side the tongue went to. From there, we're going to go to the motor functions, which is gait, posture, and if he's got any like muscular tics or anything like that. He obviously doesn't. Whenever he came walking into the room earlier at the beginning of the video, he showed that he has nice even gait. He's not drooping anywhere. He's not favoring anything. He can move all of his extremities equally. He has no muscle atrophy anywhere. So we're just going to say that motor-wise, he is excellent. From there on, we're going to go to coordination. I need you to stand up for this one. This is going to be the Romberg test. Romberg test, I'm going to have you put your arms out with your palms up. Close your eyes and stay balanced. Okay. Now I need you to hold your hands out like this. Close your eyes. And he didn't wobble whenever I did it, so that shows that he's good also. Now I'm going to have him do what's called tandem walking, which is heel toe. And I'm checking to see if he keeps his balance keeps good balance. He's got good stride, good rhythm. And then I need you to walk on your heels back to me. Okay, turn around, walk on your toes. No balance issues there. Come back here and I need you to do a knee bend for me. Just a shallow knee bend. Nice and straight. He didn't wobble while he walks or anything, so he's good to go. Alright, now I need you to sit back down. We're going to do what's called rapid alternating movements. You need to put your hands out here and you're going to slap, slap. And just keep going faster and faster and faster. Okay, that's fine. You're good there. Now we're going to do point to point. I'm going to hold my finger up and I want you to touch it with your finger, then touch your nose. I guess I'll move it. Okay, pass that with flying colors. Now we're going to do just part of the sensory. I'm going to touch him in various spots on his body with his eyes closed, and he's going to tell me where I touched him at. So I need you to close your eyes.
Knee, right knee. Scapula, left. Ankle, right. Hand, right.
Okay, so he's doing good there. The next one is called stereognosis. This is, he's going to tell me what object is in his hand with his eyes closed. So I need you to close your eyes again. Open up your hand.
That is a Sharpie.
Okay. You pass that with flying colors. Now we're going to do what's called two-point discrimination. I'm going to use a paper clip, and I've got a bent where I can touch him with either one or both of the points at the same time. He's going to tell me if I'm touching him with one or two points with his eyes closed.
One. Two. One. One. One.
Okay, you passed most of those.
Sorry.
It's alright. Alright, next we're going to do the deep tendon reflexes. The first one is brachioradialis, which is up here on the hand. We tried this earlier and he doesn't have much of a reaction to it, but we're going to give it a shot anyway. Yeah, still nothing. Let's try the other one. Let's see. Should be right there. I'm going to do it without it. Still nothing. Alright, and we're going to do the biceps. Go ahead. Nothing. These are the same findings we had earlier. There we go. Alright, now we're going to do triceps. Just hold your arm out here to the side like that. There you go. Right there. Should be right there. Nothing?
Actually, I felt it.
Did you feel it? Okay, let's try this one. Yeah, a little bit. Alright, now we're going to try patellar. He's got good patellar. A little bit on the kneecap there, it's alright. Now we're going to do the Achilles.
Okay.
Yep.
Go down. Down. There you
There
go.
we
I
go.
felt it.
Yeah, and the Achilles, it isn't so much of a jerk as it's kind of just a little motion. And now I'm going to take his foot and we're going to do the Vinsky. Can you raise your foot up to me? I'm going to start here. I'm going to go up. And he's good to go.